Have you ever laid in bed feeling like the entire world was crashing down on your shoulders? Your wife's eyes was saying nothing, but you know exactly what she's thinking. You turn away, pretending everything's fine. But inside, you're asking yourself, am I still a man? I'm Vitality Digest. If this is your first time finding this channel, welcome to the place where we talk about the things few dare to say out loud. Hit subscribe and turn on notifications so you don't miss our next videos on men's health. Today, I want to share a story with you, not mine, but the story of millions of men suffering in silence. A friend of mine, 32 years old, married for 5 years. He told me, you know what? I only lasted 30 seconds. 30 seconds, then everything was over. I felt like I was broken. And the most painful part, we don't dare tell anyone, not our friends, not our doctors, not even our wives. We just stay silent, hoping that someday things will magically get better. But they don't magically get better. Because the problem isn't about chance. It's about how our bodies respond to worry, stress, and pressure. And today I'm going to show you how to change that. Would you believe that with just one simple breathing technique combined with 2 other exercises, you can extend your intimate time up to 9 times longer? No pills, no numbing sprays, no useless TikTok tricks. Just 15 minutes a day, and after 8 weeks, your body will be completely different. Sounds unbelievable, right? But this is science, and I'm going to show you every single step. Part 1. 30% of men face this issue. Premature ejaculation isn't rare. Up to 30% of men worldwide are dealing with this problem. That means 1 out of every 3 men is going through exactly what you're experiencing. What's the medical definition of premature ejaculation? It's when you ejaculate within 1 to 2 minutes after penetration, or even before you want to. Some guys only last 30 seconds, some 9 seconds, some haven't even started yet. But this isn't just a physical problem. It profoundly affects your psychology, your confidence, and your relationships. When you're constantly afraid of finishing too fast, you can't enjoy the moment. You can't love your wife completely. You're just counting seconds, hoping this time will be different. But then you fail again, feel ashamed again, avoid intimacy again, and this creates tremendous tension and frustration in marriage. Your wife doesn't understand why you're distant, you don't know how to talk about it, and the gap between you grows wider. Part 2, the real cause, the autonomic nervous system. So what causes premature ejaculation? Turns out the culprit is usually an imbalance in the autonomic nervous system. Let me explain this simply. Your body has 2 main nervous systems. The sympathetic nervous system, fight or flight mode. When this system is highly active, your body thinks it's in danger. It sends the signal, finish quickly. And the ejaculatory reflex happens immediately. The parasympathetic nervous system, rest and digest mode. When this system is active, your body relaxes, heart rate decreases, and you can control the ejaculatory reflex. Research shows men with premature ejaculation typically have higher activity in the sympathetic nervous system. This system controls the ejaculatory reflex. When it's overactive, you ejaculate very quickly. And what triggers the sympathetic system? Stress, anxiety, pressure, or pelvic floor dysfunction. That's why more anxiety, faster ejaculation, more shame, even more anxiety next time. This is an endless loop, and if you don't break this cycle, you'll stay trapped forever. Part 3. Good news. You can control your nervous system with breathing, but here's the good news. We can influence the nervous system with just our breath. Sounds too simple, right? But this is science. The diaphragm and pelvic floor muscles actually work in coordination to regulate arousal and the ejaculatory reflex. When you breathe correctly, these 2 muscle groups operate more effectively, and when they work well, you can control when you ejaculate. A specific type of breathing exercise called diaphragmatic breathing can help you activate the parasympathetic system, reduce excessive sympathetic activity, and simultaneously strengthen the pelvic floor muscles. Sound complicated? It's actually very simple, and I'll show you how to practice it right now. Part 4. Current treatment methods. Currently, most premature ejaculation treatments are off-label, meaning there are no officially approved medications. Common methods include stop-start technique, bring yourself close to orgasm, then stop. Repeat 3 times and ejaculate on the fourth. Sometimes includes gently squeezing the tip of the penis when stopping to reduce arousal. Delay sprays or numbing creams applied to the penis to reduce sensitivity, but many find it uncomfortable and sometimes it numbs the partner too. Off-label medications. Some antidepressants or erectile dysfunction medications are used to treat premature ejaculation, but they have side effects, and not everyone wants to depend on drugs. But the good news is there are breathing exercises combined with pelvic floor exercises that can help you improve without medication, without sprays, without applying anything to your body. Part 5. The scientific study, 900%. A recent study examined the combination of these techniques, and the results were dramatic. Scientists recruited 62 men with premature ejaculation and divided them into 2 groups. Group 1, pelvic floor exercises, Kegels, stop-start technique. Group 2, pelvic floor exercises, Kegels, stop-start technique plus diaphragmatic breathing exercises. Both groups practiced twice daily, 3 days per week for 8 weeks. With pelvic floor exercises, they learn to contract and release the muscles at the right time to recognize when they're about to ejaculate and control that reflex. How to practice. Contract for 10 seconds, release for 10 seconds, repeat 15 times. Then contract for 1 second, release immediately, repeat 10 times. They also practice the stop-start technique, as I just mentioned. But Group 2 added one more step, diaphragmatic breathing exercises. Part 6, how to breathe diaphragmatically correctly. Diaphragmatic breathing, or belly breathing, is very simple. Sit up straight. Place both hands on your lower ribs, just below your chest. Breathe in slowly through your nose. Feel your belly expand like a balloon. Not your chest, your belly. Breathe out slowly through your nose. Feel your belly deflate gradually. Repeat 10 times, twice daily. This slow, deep breathing activates the parasympathetic nervous system. It helps reduce excessive sympathetic activity, the cause of premature ejaculation. At the same time, it strengthens the pelvic floor muscles, helping you control ejaculation better. That's all there is to it. But the results? You won't believe it. Part 7. Results after 8 weeks. After 8 weeks, both groups improved because they both practiced pelvic floor exercises and behavioral techniques. But the group that added breathing exercises had significantly superior results. Scientists measured intravaginal ejaculatory latency time, called IELT, meaning how long men could last before ejaculating. The breathing group, time increased from 30 seconds to 302 seconds, about 5 minutes, 900% increase. The non-breathing group, time increased from 30 seconds to 238 seconds, 690% increase. This means the breathing group lasted an average of 1 minute longer than the other group. 1 minute might not sound like much, but when you only last 30 seconds, 1 minute is a massive difference, but that's not all. Part 8, changes in pelvic floor and nervous system. Not just extending time, the breathing group also showed significant improvement in pelvic floor strength and endurance. They contracted more strongly and held longer than the other group. This means they had better ability to control the ejaculatory reflex. And there was an interesting change in the autonomic nervous system. When scientists measured heart rate variability, called HRV, they discovered the breathing group had more pronounced improvement. Higher HRV means increased parasympathetic system activity. This is the rest and digest system that helps regulate the ejaculatory process. When the parasympathetic system is stronger, you can control the ejaculatory reflex better. You're no longer swept away by arousal. You can pause, breathe deeply, and continue. This is something medication can't do. This is something sprays can't do, but breathing can do it. Part 9, the complete 3-step combo. Now, let me summarize this for you in detail and make it easy to apply. Step 1, 5 minutes of diaphragmatic breathing. Sit straight or lie on your back. Place both hands on your lower ribs. Breathe in slowly through your nose, letting your belly expand. Breathe out slowly through your nose, letting your belly deflate. One breath lasts about 6 seconds. Repeat 10 breaths. Rest 30 seconds. Then do another round. Total about 5 minutes. Practice twice daily. Step 2, 5 minutes of proper Kegels. Kegels are exercises for the pelvic floor muscles, the group of muscles between your pubic bone and tailbone. Contract the muscles as if you're trying to hold in urine. Hold for 10 seconds, release for 10 seconds, repeat 15 times. Then contract quickly for 1 second, release immediately, repeat 10 times. Note, don't contract your abdomen, thighs, or buttocks. Only contract the pelvic floor muscles. Practice twice daily, 3 days per week. Step 3, 5 minutes of stop-start technique, self-stimulate, or with your wife if she agrees to help. When arousal increases to about 70%, meaning you feel it's coming, stop immediately. Take 3 deep breaths. Diaphragmatic breathing, slowly. After about 5 to 7 seconds, the sensation will decrease, then continue. Repeat this 3 times. On the final round, you can ejaculate to release nervous tension. Part 10, applying it during actual intercourse. You can practice perfectly at home, but when you're in bed for real, you forget everything. So what do? 1, when you feel you're about to ejaculate, breathe in deeply for 4 seconds. Hold for 1 second. Breathe out slowly for 6 seconds. After 5 to 7 seconds, arousal will noticeably decrease. You can continue. 2, slow down your hip movement when overstimulated. Don't stop abruptly. Slow down gradually, move slower, more gently, and remember to breathe steadily. 3, choose less stimulating positions. Some positions are more stimulating. If you can't control it, switch to less stimulating positions like side by side, woman on top, or half missionary. 4, know when to withdraw. If sensation exceeds 85%, withdraw for a few seconds. Breathe deeply, then continue. Part 11, the role of your wife, partner. Men can't solve this alone. Tell your wife, honey, I'm trying a scientific method to improve. When I signal you, can you help me slow down a bit? Your wife can support by switching to less stimulating positions when you ask, participating in the stop-start technique, reassuring you instead of blaming, breathing together before intimacy. When you work together, results will come twice as fast. Part 12, dangerous mistakes to avoid mistake. 1, doing too many Kegels. Overly tight pelvic floor will make you ejaculate faster. Mistake 2, forcing the breath. Breathing should be gentle. If you force too hard, you'll get dizzy. Mistake 3, stopping too late. Stop when sensation is only at 70%. Mistake 4, only practicing during masturbation. Apply it with your wife too. Mistake 5, watching too much adult content. This destroys your real sensation threshold. Mistake 6, hiding from your wife. When you hide, pressure builds and you ejaculate faster. Part 13, the impact of stress, poor sleep, hormones. Stress and sleep deprivation increase sympathetic nervous system activity. When your body is exhausted, the ejaculatory reflex intensifies. If you sleep less than 7 hours per night, improve your sleep. If you're stressed from work, find ways to reduce stress. Walking, meditation, or breathing exercises. Hormones also play a role. If you suspect problems with testosterone or serotonin, see a doctor for testing. And porn addiction, your brain becomes accustomed to extremely intense, rapid stimulation. During real intercourse, your brain doesn't know how to process slow, gentle stimulation. Gradually reduce it or stop completely during the first 8 weeks. Part 14, complete checklist. Diaphragmatic breathing 5 minutes twice daily, Kegels at proper intensity twice daily, 3 days per week, stop-start 3 rounds 3 times per week, reduce sympathetic, increase parasympathetic. Talk honestly with your wife, choose appropriate positions during intercourse, reduce adult content consumption, sleep adequately, at least 7 hours nightly, reduce life stress, stay consistent for 8 weeks. If you're feeling ashamed, if you feel like you're not good enough, if you think you're broken, remember, 30% of men are dealing with this same issue. Millions of men have been in your exact position. They've also spent sleepless nights wondering if they're still real men, but they changed, and you can too. The amazing thing is, you have more control over your sexual health than you think. With the right tools and techniques, you can retrain your body and mind to last longer and enjoy intimacy without worrying about finishing too fast, without pressure or insecurity. Just 15 minutes a day, no medication, no sprays, nothing applied to your body, free and effective. You're not broken. Your body just needs recalibration. If this video was helpful, don't forget to subscribe to Vitality Digest so you don't miss our next videos on men's health. Together, we'll become stronger, healthier, and happier. See you in the next video.